Welcome back to my channel. And if you are visiting this space for the first time, you are also highly welcome. In this lecture, we'll be looking at the sacrum. Let's try and use this image by the side here to illustrate where the sacrum is located. This is the configuration of the pelvic cavity. And at the posterior end here that is harrowed in red is where we have the sacrum. The sacrum is seen at the posterior part of the pelvic cavity. So write on with me as I describe the general configuration of the sacrum and also highlight the structures that are related to its specific regions. Before we dive into the general morphology of the sacrum, let's try and highlight the functions of the sacrum. The sacrum is a very strong bone when compared with its counterpart in the vertebral column. It is a strong bone that is seen to fill the posterior part of the pelvic cavity. So this structure that is highlighted here in this image is the sacrum, and it is seen to fill the posterior region of the pelvic cavity. It is also seen to connect with other neighboring bones. If you look at the sacrum, you see that it has a number of bones around it. So it is seen to form joints with this bone, such as the fifth lumbar vertebra. This structure that is highlighted here in blue is the fifth lumbar vertebra. And this fifth lumbar vertebra is seen to connect with the superior edge of the sacrum through the intervertebral disc. And this is what is highlighted here at this point. So you see that it tries to create joint with this neighboring bone. And this is specifically referred to as the lumbosacral joint. As I've always said on this channel, all we need to do is to break down the name. Lumbosacral joint is the joint that is created between the fifth lumbar vertebra and also the sacrum. It is also seen to form a connection with the ilium. If you look at this other side, this is where we have the ilium. We have two. We have one on the right and one on the left. The ilium is a sub-region of the hip bone, and it is located at this upper region where it is seen to create a connection point with the sacrum. So at this point, you see the ilium forming a connection with the sacrum, and the specific name that is given to this joint is the sacroiliac joint. So if you break down the name, the sacroiliac joint, it means the joint that is seen to connect the sacrum with the ilium of the hip bone. You can see that the sacrum connects with its neighboring bones through joints. And this is what we have tried to highlight. And because of this, it is able to transmit the weight of the upper part of the body to the pelvic cavity. So this is where we have the arrow pointing here, of course, directing the weight from the upper part of the body. And you see it releasing it into the pelvic bone. And this is what is seen to be highlighted here in dotted black. And what this does is that it helps to neutralize the weight of the upper part of the body, because as it descends down along the vertebral column and getting to this point, the weight is transmitted into the pelvic bone so that it is not felt at the lower part of the body. So this is what happens in terms of weight transmission from the upper part of the body to the lower part of the body. It's also seen to create attachment sites for muscles and also ligaments. As we go through with this lecture, we would see the specific regions of the sacrum that are created for muscular and also ligamentous attachments. And finally, the sacrum is seen to support body posture and also help to maintain stability, especially during sitting posture. The sacrum is seen to play a great role in this process. Let's go to the general structure of the sacrum. The sacrum is seen as a collection of bones that are fused together. So we have 5 sacral bones, which are 5 sacral vertebrae, and these vertebrae are seen to be fused into a single unit that is referred to as a sacrum. And this fusion leads to the formation of a triangular configuration. So you see that we have 5 sacral bones. We try to use this image by the side here. This is the first sacral bone. This is the second sacral bone. This is the third, the fourth, and also the fifth. But these 5 sacral vertebrae are seen to be fused into a single unit. And not just that, this fusion is seen to present a triangular configuration. And we've also said that the sacrum forms part of the pelvic spine. If you look at this image up here, this is the configuration of the pelvic cavity. This is what the pelvic cavity looks like. And structurally, the pelvic cavity is made up of 2 hip bones, one on the right side and one on the left side. In the anterior part, these hip bones are seen to be connected at the pubic symphysis. And this is what is harrowed here in green. So you see the pubic symphysis to connect specific regions of the hip bones together in the anterior part. And specifically, it is the body of the pubic that is seen to be connected at this point. We've tried to highlight this in our lecture on the bony pelvics. If you've not checked that lecture, please kindly go and do so. In that lecture, we described that the hip bone is structurally made up of the ilium, the pubic, and also the ischium. So at this specific region in the anterior part here is where we have the pubic. And we know that the pubic is made up of the body and also the superior and inferior rami. So it is specifically at the region of the body, at this region here that this arrow is pointing, that we have the creation of the pubic symphysis. And this is where the two hip bones are seen to be connected in the anterior part. While posteriorly, the pelvic bone is seen to be connected through the sacrum. So if you look at this structure that is highlighted here in red, is where we have the sacrum. And it is through the sacrum that the two hip bones, both on the right and on the left side, are seen to be linked together. And this is what is seen to be harrowed here in red. While inferiorly, we have the coccyx. So you see that the configuration of the entire pelvic bone is made up of two hip bones, one on the right and on the left. And posteriorly, we have the pelvic spine. The pelvic spine is made up of the sacrum and also the coccyx. So we can say that the sacrum makes up the chunk of the pelvic spine, while the remaining part of the pelvic spine is made up of the coccyx. So let's drive further to see how the sacrum fits into the pelvic bone. This is where we have the pelvic bone. And of course, we say in the posterior part is where we have the sacrum. The sacrum is able to fit into the pelvic bone through the sacroiliac joint. This is where we have the sacroiliac joint here, harrowed at this point. We have two. We have one on this side and we have the other one on the other side. This sacroiliac joint, you see that this joint exists between the sacrum, which is highlighted here in red, and also the ilium, which is on this other side. The ilium is a structural component of the hip bone. So the joint that exists at this point is the sacroiliac joint. And it is through these two joints that the sacrum is able to be connected to the ilium. This can be classified as a synovial type of joint, which means that it has synovial apparatus embedded within it. It can also be classified in terms of movement as a diarthrodial type of joint. This is a type of joint that allows free movement. So in trying to classify this joint, it's good for us to be able to establish the class that they belong to in case we come across this during examination. Then it's important for us to note that apart from the sacrum creating a link with the ilium, it is also seen to form a connection point with the fifth lumbar vertebra. This is where we have the first sacral bone up here at the most superior part. And above it, we have the fifth lumbar vertebra. And this fifth lumbar vertebra is seen to be connected with the first sacral vertebra through the intervertebral disc. So you see that it is not just connected with just the ilium. Superiorly, it is seen to form a connection with the fifth lumbar vertebra. And this joint is referred to as the lumbosacral joint. This joint can be classified as a cartilaginous joint, and specifically it can be classified as a secondary cartilaginous joint. And this is the joint here created here at this point. We also have the sacrum also forming a connection with the coccyx. And at this point, harrowed here in green, is what is referred to as a sacrococcygeal joint. This sacrococcygeal joint can be classified also as a cartilaginous type of joint. And it is specifically a secondary cartilaginous joint. Going further on the sacrum structurally is a flat type of bone and it's triangular in shape. And this triangular configuration is inverted. So this is the kind of configuration that the sacrum presents, where you have the base pointing upward and you have the apex directed downwards, because it is an inverted triangular flat bone. So this is the kind of configuration that is seen or presented by the sacrum. If you look at this image here, this is the configuration of the sacrum. And if you look on top here, is where we have the base. The base of the sacrum is formed by the first sacral bone. This is the first sacral bone, the first sacral vertebra. Then you have the second, the third, the fourth, and also the fifth sacral vertebrae. And that is how they are connected with one another. So if you look at this alignment above, is where we have the base, and you see that the base is wide. It is directed upward, as we've said, because it is inverted triangular bone, and it is also directed forward. So in anatomical position, there is a way that the sacrum will be placed. We know that the base is directed upward and it is pushed further forward. So that is the way it is positioned in anatomical plane. If you drive more into the base of the sacral bone, we have a number of features that we need to highlight. And the first one is the sacral promontory. This is the sacral promontory here, carried at this point. The sacral promontory is the eminence that is created by the first sacral bone. Remember when we try to arrange the sacral vertebrae, we said that this is the first, the second, third, fourth, and fifth. So it is the first sacral vertebra that is seen to present this eminence that is referred to as sacral promontory. This sacral promontory is an important landmark in establishing the configuration or alignment of the pelvic inlet. If you try to use this image down here, this is where we have the sacral promontory here, carried at this point. And this is where we have the alignment of the pelvic brim or the pelvic inlet. The prominence of the sacral promontory will determine the orientation of the pelvic inlet. If the eminence of the sacral promontory is large, it is going to alter the shape of the pelvic inlet. And you see this kind of presentation more in the male pelvis, where it takes a heart-shaped configuration because of the indentation that is created by the sacral promontory at this posterior part. And if you have a less prominent sacral promontory, it means that the pelvic inlet or the pelvic brim will be rounded or oval in shape. And this is the kind of presentation that you see in the female pelvis. And this kind of configuration means that the pelvic inlet will be wide so as to allow for the passage of the head of the baby during vaginal birth. So you see that the rate of prominence that is created by the sacral promontory will be altering the configuration and also the size of the pelvic inlet. And this is an important landmark in establishing the types of pelvics that will suit vaginal birth. Then the second structure that we see, going back to this image by the side of the base of the sacral bone, is a smooth part that is harrowed here at this point. This smooth part is the body of the first sacral bone. And this is what receives the lumbar vertebrae. This specifically is receiving the fifth lumbar vertebra. This is also seen at the region of the base of the sacral bone. Then the next structure is the superior articular facet. And this is what is harrowed here at this point. This superior articular facet is what receives the inferior articular facet of the fifth lumbar vertebra. You see that the lumbar vertebra, we initially describe it having a connection point at this smooth part. So we also have the articular facet also having a connection at this other point. If this is to further give structural connection between these two bones along the vertebral column. So you see that around the base of the sacral bone, we have a number of features that we have highlighted. Then if you go to the apex, because we say it is an inverted triangular bone, the apex we say is directed downwards. So this is where we have the apex here at this point. The apex of the sacrum is blunt. It is not sharp because it will be creating an indentation that will be accepting the coccyx. So this is where the coccyx is connected to the sacrum at this point. And this apex is formed by the fifth sacral vertebra. So the fifth sacral vertebra, the most inferior head here, we have the apex of the sacrum. And that specifically at the region of the apex, we have a facet that is created to accept the coccyx. We see that specific point, we have different transformations going on so as to accept the neighboring structures. So let's drive through to the surface. We have four surfaces. The sacrum has an anterior surface, and this is the anterior surface here, using this image up here. The anterior surface, we have just one. We have the posterior surface. Using the inferior image here, this is the posterior surface here behind. Then we have two lateral surfaces. And these are the surfaces here on the right side, and we have another one on the left side. So all in all, we have 4 surfaces. And we'll be driving into each of these surfaces. And along this course, we'll be establishing specific structures that are located or related to each of the surfaces. So for the anterior surface, it is also referred to as the pelvic surface because it is the surface that is related to the pelvic cavity. If you look at this structure here, the surface that is exposed in this image is the anterior surface. This surface is concave and is smooth. If you try to use this image down here, the structure that is highlighted here in red is the sacrum, and the surface that is exposed at this region is the anterior surface. You see that there's an indentation created around the surface. So it is concave and it is also smooth. If you look through this surface, we have 4 horizontal ridges or transverse ridges. And this is what is harrowed here in red. So we have 4. This is the first one. This is the second, the third, and also the fourth. Because we have 5 sacral vertebrae, we have 4 transverse ridges. These transverse ridges are remnants of the intervertebral disc. Remember that when we started this lecture, we said that the sacrum is made up of 5 sacral vertebrae, of course, fused together. And at the point of connection, we have intervertebral disc. Before this fusion will occur, this intervertebral disc will be seen to link each of the vertebrae together. And after fusion, the remnant of this intervertebral disc is what is then seen as the horizontal or the transverse ridges. And this is what is harrowed here in red. So it's good for us to establish this. If you look at on both sides of the transverse ridges, we have foramina, and this is what is seen to be harrowed here at this point. We also have 4 anterior sacral foramina, and they are paired, which means we have one on the right and the other one on the left. So in totality, we have 8 anterior sacral foramina. And this is what is highlighted here at this point. And this anterior sacral foramina are seen to allow for the passage of the anterior rami of the sacral spinal nerves. And it will be allowing for just the anterior rami from S1 to S4, because we have 4 sacral anterior foramina on one side and another one on the other side. If you look at this structure deep, you see that we have the spinal cord at the upper part, which of course will terminate around the second lumbar vertebrae. On both sides of the spinal cord, we have the emergence of the spinal nerves. We have one on the right and we have another one on the left. These spinal nerves will further subdivide into anterior rami and also posterior rami. And these 2 rami, as presented on this side, we also have it on the other side. So if you look at the configuration above, you see that the emergence of the rami are on the side. And of course, they will pass through the intervertebral foramen before they exit that space. So it is by the side that we have the emergence of the rami. But when we get to the sacral region, you see that the emergence of the rami pass through the anterior and the posterior sacral foramina. We'll be getting to the posterior sacral foramina as we go through to the posterior surface of the sacrum. But for the anterior surface here, we have the anterior sacral foramina. And this is where the anterior rami of the sacral spinal nerves will exit the sacrum. So you have the anterior rami of S1, anterior rami of S2, anterior rami of S3, and anterior rami of X4. So we have the anterior rami now passing or exiting the sacrum through the anterior sacral foramina. But if you go above from the other emergence around the lumbar, the thoracic, and also the cervical region, you see that the anterior rami would emerge from the side. While in the sacrum, it is seen to emerge in the anterior part. And it's good for us to establish this. And this is due to the configuration of the sacrum. There is no opening around the lateral side of the sacrum for this rami to exit the sacrum. The only region where these foramina are created is in the anterior and the posterior part. And it is where these foramina are created that this rami will be able to exit different vertebral bones. So this is what is said to pass through the anterior sacral foramina. So we now know that the anterior rami from S1 to S4 are seen to part or exit the anterior sacral foramina. It is also important for us to know that we have the fifth sacral spinal nerve, but it is not highlighted here at this point because there is no foramen created in the anterior part for its exit. But we would see as we go through with this lecture how the fifth sacral spinal nerve will exit the sacrum. So it's good for us to highlight this point. It's also good for us to have the fact that we have a canal created within the sacrum, and this is referred to as the sacral canal. And this is what is saying to be highlighted here in blue. So we have this opening, and you see it descending down along the sacrum. And this is what is also seen to be highlighted here in blue. So you have a space created within the sacrum, and this space is referred to as the sacral canal. This sacral canal is seen to be connected with both the anterior and posterior sacral foramina. And this is what is seen to be highlighted here in yellow. So you have it connecting to both the anterior sacral foramina that is created here at the anterior surface, and also the posterior sacral foramina that is created also at the posterior surface. The sacral canal and also the sacral foramina needs to connect or communicate because the nerve bundles that would emerge at the terminal part of the spinal cord will need to pass through the sacral canal before they finally find their way out to exit the sacrum through the anterior and the posterior sacral foramina. So there is need for this structural connection to occur. So I've highlighted some of the structures that we have in the anterior surface of the sacrum. It's also good for us to dwell more on the structures that are related to it. So in the anterior part, we have the ventral rami from S1 to S4 as we've highlighted. This is related to the anterior surface of the sacrum, and this is how it runs, of course, passing through the anterior sacral foramina. We also have the piriformis. The piriformis takes its origin from the sacrum, and this is the pattern by which it emerges. And this is what is highlighted here in yellow. So you see it emerging from the space between the first and the second anterior sacral foramina, and also the space between the second and the third anterior sacral foramina, and finally also extending to the space between the third and the fourth anterior sacral foramina. So this is the pattern by which it emerges around the anterior surface of the sacrum. And you see it being directed or inserted on the greater truncata of the femur. We also have the median sacral artery. The median sacral artery is a posterior emergence from the abdominal aorta, just at its point of termination into the common iliac on the right side and also on the left side. We also have the lateral sacral artery, also relating to the anterior surface of the sacrum. So let's see how these two arteries would emerge and also taking their part or course around the anterior surface of the sacrum. So this is where we have the abdominal aorta. The abdominal aorta at this point will bifurcate finally into the common iliac on the right, also the common iliac on the left. So at the posterior edge or posterior region of where this bifurcation occurs, around the inferior part of the abdominal aorta, we have the emergence of the median sacral artery. And this is how it runs along the midline region, of course, passing through the anterior surface of the sacrum. We also have the emergence of the lateral sacral artery that is also highlighted here in red. And this lateral sacral artery is an emergence of the internal iliac artery. The lateral sacral arteries are two in number. We have one on this side. We also have another emergence on the other side. So as it emerges from the internal iliac artery, you see it running through this course, and this is how it becomes positioned around the anterior surface of the sacrum. We also have the anterior longitudinal ligament. This is the anterior longitudinal ligament here, highlighted in green. This anterior longitudinal ligament is seen to reinforce the intervertebral joint along its anterior surface. And you see this anterior longitudinal ligament is an extension from the superior part of the vertebral column, extending down to the sacrum. So you see it on the anterior surface, of course, helping to reinforce the intervertebral joints. Then finally, we have the sympathetic chain, and this is what is highlighted here in purple. You have two, one on the right side and the other one on the left side. This sympathetic chain is a chain network of nerve that is seen to extend from the cervical region down to the sacrum. And you see it on both sides of the vertebral column. So if it is positioned around that region, you see it also descending along the anterior surface of the sacrum. So these are the structures that are related to the anterior surface of the sacrum, and this we've been able to highlight or illustrate effectively. So let's drive more on the anterior surface of the sacrum. There is a specific region that is referred to as the ala or the wing of the sacrum. This is the region here, harrowed in yellow, expanded mass of the sacrum. So this structure can further be subdivided into the smooth anterior part at the front and also the rough superior part above. So it has the anterior part or region here that is smooth and the rough superior part here that is harrowed in blue. So let's drive into each of these regions to see the structures that are related to them. For the smooth region, it is related to the iliacus muscle. We know that the iliacus muscle is seen to feed up the iliacus fossa. And the iliacus fossa is the indentation that is created by the ilium. So there's going to be an extension of this iliacus muscle onto the lateral edge of the smooth part of the ala of the sacrum. And this is what is highlighted here in this image. If you try to use this image down here, this is where we have the iliac fossa. And the iliac fossa, we know it is filled with the iliacus muscle. And if you look at this iliacus muscle at this point, you see that part of the fibers are seen to extend into the lateral edge here of the smooth part of the ala or the wing of the sacrum. So this is how the iliacus is related to this lateral edge of the smooth part of the ala of the sacrum. We also have a number of structures that are related to the smooth part of this region. And these structures will be taken from lateral side to the medial side. From the lateral side, we have the obliterator nerve. This is the obliterator nerve here, highlighted here in purple. The obliterator nerve is one of the branches from the lumbar plexus. We also have the iliolumbar artery. The iliolumbar artery is what is highlighted here in red. We know that the iliolumbar artery is a branch from the internal iliac artery. So as it emerges from the internal iliac artery, you see it aligning with the smooth anterior surface of the ala of the sacrum. We also have the lumbosacral trunk. This is the lumbosacral trunk here highlighted in green. We know that the lumbosacral trunk is a trunk that is formed by the anterior rami of L4 and L5 spinal nerve. We try to describe this lumbosacral trunk in our lecture on the sacral plexus. If you've not also checked that lecture, please kindly go and do so. Then the next structure is the sympathetic chain, and this is what is highlighted here in black. Remember, we described this sympathetic chain in our previous slide when we tried to highlight the structures that are related to the anterior surface of the sacrum. So these are the four structures that are related to the anterior smooth surface of the ala or the wing of the sacrum. And the acronym COIL can be used to remember easily the list of these structures. So this is how they align from lateral to medial. So if you go back to the rough surface here that is harrowed in blue, we say that the superior upper surface is rough, and this roughness is created because of its attachment to ligaments. So it is seen to be rough because it creates attachment site for the lumbosacral ligament. So you have strands of lumbosacral ligaments connecting the rough edge here, superior edge, to the lumbar vertebrae. So this rough edge is specifically created for the attachment of ligament, and that is why it appears or is seen to be rough. Then if you look at the lateral edge at this point that is arrowed here in blue of the ala is related to the anterior sacroiliac ligament. We know that the next region that will be seen around this space is the ilium of the hip bone, and there's going to be a connection between the ilium and the sacrum at this region, and this will be taken as the sacroiliac joint. We also have ligaments reinforcing this joint anteriorly. So at this point, we have the emergence of this anterior sacroiliac ligament, of course, connecting the ala of the sacrum with the ilium. So these are the specific structures that are related to the ala or the wing of the sacrum. We've tried to subdivide this region into the smooth anterior part and also the rough superior part, and also highlighting the different structures that are related to it. So now go to the posterior surface. The posterior surface is convex and it seems to be irregular. Remember when we try to describe the anterior surface, we say it is concave and it is smooth. For the posterior surface, it is convex and it is irregular, which means that it has a lot of eminences and also protrusion. So let's drive into the posterior surface to see what the posterior surface of the sacrum presents. Before we drive into establishing the configuration of the posterior surface of the sacrum, it's good that we highlight the posterior longitudinal ligament. Remember, we described the anterior longitudinal ligament. When we try to explain the anterior relations of the sacrum, we say that the anterior longitudinal ligament is related to the anterior part of the sacrum, trying to reinforce the intervertebral joints. So posteriorly, we also have the posterior longitudinal ligament, but the posterior longitudinal ligament is not seen at the posterior end of the sacrum. It is seen at the posterior part of the body of the sacrum. So this is where we have the posterior longitudinal ligament that is highlighted in green, and this is where we have the body of the sacrum that is highlighted here in blue. This is the body of the sacrum. This is the structure that receives the body of the fifth lumbar vertebra. We tried to describe this in our previous slide when we tried to establish the lumbosacral joint. So behind these bodies is where we have the location of the posterior longitudinal ligament. So you see it reinforcing these joints behind the body of the sacrum. We also have the sacral canal. This is the sacral canal here, arrowed in yellow. The sacral canal is a hole or space that is created also behind the body of the sacrum. And if you remember in our previous slide, we tried to describe the sacral canal as a space that is seen along the sacrum. So behind the body of the sacrum, we have a number of structures, and we'll be dwelling more on these structures as we go through with this lecture. So let's drive back to the posterior surface of the sacrum. See the different features that it presents. So we have the median sacral crest. This is the median sacral crest here. This is an elevation that is highlighted here in blue. It is median because it is located along the median plane. And it is a crest because it is like a swelling or a tubercle that is created around this region. Specifically, we have 4 spinous tubercles making up this median sacral crest. So we have the first one, the second, the third, and also the fourth. So if you look at this alignment, you have eminences seen along this median course. And this is what is referred to as the median sacral crest. This median sacral crest is formed by the spinous processes of the sacral vertebrae. Remember when we started this lecture, we said that the sacrum is made up of a collection of bones, which are the sacral vertebrae that are fused together. We know that vertebrae generally are seen to have spinous processes. So these spinous processes is what is seen at this point. And because they are fused together, it is not seen like a crest. So if you drive deep, you see that this median sacral crest is formed by the spinous processes of the sacral vertebrae from S1 to S4. And because they are fused together at this point, so there's a fusion or a union at this region, and this is what creates this median sacral crest. The fifth spinous tubercle is not formed at this point because of the non-union of the lamina of bone that is formed at the posterior part of the sacrum. And this is what leads to this opening that is referred to as the sacral hiatus. This we would get to as we go through with this lecture. But it's good that I like that it is just 4 spinous processes, which is the superior 4, that is seen to form this median sacral crest, while the fifth spinous tubercle is not seen to be used in creating this alignment. And lateral to the median sacral crest, we have the intermediate sacral crest. This is the intermediate sacral crest here, highlighted in dotted red. This intermediate sacral crest is formed from the articular processes of the individual sacral bones. We know that the sacrum is a collection of the sacral vertebrae that are fused together. And this is what is seen to be highlighted here in this region. And if you look at this alignment, you see that it falls in the same alignment with the superior articular facet. This is the superior articular facet of the first sacral vertebra, and this is what is harrowed here at this point. So the articular processes of the inferior sacral vertebrae will also be formed along this orientation. And because they have become fused, it is going to lead to the formation of the intermediate sacral crest. And this is what is created here at this region. If you also go more lateral, you have the lateral sacral crest. And this lateral sacral crest is what is seen to be highlighted here in dotted blue. This lateral sacral crest is formed from the union of the transverse processes of the individual sacral vertebrae. And this is what is saying here, because we say that the sacrum is a fused bone that is structurally made up of 5 sacral vertebrae. And of course, specific regions of these vertebrae will become fused together to form this individual crest that we have highlighted. If we go back to the orientation of the vertebral bone, using this image down here, we know that the vertebral bone is seen to have a spinous process, and this is what is harrowed here at this point. The spinous process is an elongation that emerges along the midline plane. And we say that because this individual sacral bone is seen to also have spinous processes, but of course they will become fused because the sacrum is a collection of fused 5 sacral vertebrae, and they are formed along the median plane. And this is what leads to the formation of the median sacral crest that is highlighted in this upper image here in blue. They emerge along the midline plane, and when they become fused, they will also be seen along that region. Then if you go more lateral, you have articular processes. This is the articular processes here, arrowed in dotted red using this lower image. And we also say that these articular processes of the individual sacral vertebrae will also be fused together. At this point, they now create an alignment that is referred to as intermediate sacral crest. And this is what is highlighted here in this upper image in dotted red. And if you also see that it falls in the alignment of the articular facet of the first sacral vertebra. And if you also look through, you see that the articular processes are 2 in number. We have one on this side and we have another one on the other side, which means that the intermediate sacral crest will also be 2 in number. This is one that we have highlighted in this upper image. It means we'll be having another intermediate sacral crest on this other side, while the median sacral crest will just be one, of course, along the midline plane. Then if you go to the lower image, this is where we have the transverse process. The transverse process are also 2 in number. You have one on this side, and you have another one here on the other side. These are transverse emergence along the horizontal orientation. So you see these 2 processes emerging, and the fusion of these processes along the sacrum is what is seen to form the lateral sacral crest. And this is what is highlighted here in this upper image in dotted blue. And of course, we'll be having 2 lateral sacral crests. We'll be having one on this side, and we'll be having another one on the other side. Also elaborating more, it's good for us to know the individual structures of the vertebrae that are responsible for the formation of the median, the intermediate, and also the lateral sacral crest. So driving more on the posterior surface, having highlighted the different sacral crests that we have using our previous slide. For this slide, we'll be looking at the posterior sacral foramina. On the posterior surface of the sacrum, we have 4 pairs of posterior sacral foramina, and this is what is seen to be harrowed here in yellow. We have 4 on one side, and we have another 4 on the other side. And this will allow for the passage of the posterior rami of the sacral spinal nerve from S1 to S4. So this is what is said to be highlighted here in black. So we have the exit point of the posterior rami of the 1st to the 4th sacral spinal nerves exiting the sacrum through the posterior sacral foramina. Remember, we have the anterior sacral foramina that is created on the anterior surface, and this will allow for the exit of the anterior rami of the sacral spinal nerves from S1 to S4. So for the posterior surface, where we have the posterior sacral foramina, we have the dorsal rami or the posterior rami of the sacral spinal nerves from S1 to S4. Remember, we have 5 sacral spinal nerves. So the 5th sacral spinal nerve will exit the sacrum through the sacral hiatus. And this is the next area that we would be highlighting. So we have the sacral hiatus here at this point here. The sacral hiatus will allow for the passage of the 5th sacral spinal nerve and also the 1st coccygeal nerve. So these nerves are seen to exit this opening, and this occurs as a result of the non-union of the lamina of bone that is formed at the posterior part of the sacrum. We would be dwelling more on the sacral hiatus to explain in details how this opening is formed. And it is through this hiatus that the 5th sacral spinal nerves will find its way out of the sacrum. So you have the pair of the 5th sacral spinal nerve and also the pair of the coccygeal nerves also exiting the sacral hiatus. Then another structure that is seen around the posterior surface of the sacrum is the sacral conua. And this is what is seen to be harrowed here at this point. We have one on this side and we have another one on the other side. These sacral conua are branded projections that are seen around the sacral hiatus. Remember when we tried to describe the joint of the sacrum, we said that inferiorly it is connected to the coccyx. It is through this sacral conum that this sacrum becomes connected with also the conum of the coccyx. So this creates like a connection site or connection point through which the coccyx is connected with the sacrum. So we have these rounded projections where we have the sacral hiatus. Then finally, we have the sacral tuberosity. If you go more lateral around this edge, just at the lateral edge of where we have this lateral sacral crest, at this edge is a rough area that is created. If you go back to our lecture on the pelvic joint and the pelvic ligament, if you've not checked that lecture, please kindly go and do so. In that lecture, we describe the ligaments that are seen to reinforce the joint of the pelvic cavity. And one of these ligaments is the posterior sacroiliac ligament. This is the ligament that is seen at the posterior part of the sacroiliac joint. It is seen to reinforce the sacroiliac joint posteriorly. And it is on the sacral tuberosity that this ligament is attached to. We also have the attachment of the interosseous ligament, but it is located deep to the posterior sacroiliac ligament. So these two ligaments find the attachment site on the sacral tuberosity that is created on the lateral side, just around the posterior surface. So it's good for us to highlight these specific regions and also the structures that are related to them. Now let's look at the structures that are related to the posterior surface of the sacrum. We have the multifidus. This multifidus muscle is seen to be related to the posterior surface of the sacrum in this version. So you see it covering the posterior sacral foramina. So you have one on this side and you have the other one on the other side. The second muscle is the erector spinae, and this is what is seen to be highlighted here in blue. You also have two of these muscles on both sides. You have one on this side and you have another one on the other side. And you see it overlapping on the multifidus. So you see the multifidus is located deep, while the erector spinae is located at the superficial region. So this is where it takes its origination site, and you see it ascending up on both sides of the vertebral column. You also have the gluteus maximus. The gluteus maximus is related to the posterior surface of the sacrum too, and you see it at this region here that is highlighted in green. So you see it at the lower angle here on one side, and you also see the other one on the other side. So these are the muscles that are related to the posterior surface of the sacrum. So let's try and dwell more on the sacral canal. Let's see how this canal, the orientation, and also structures that are related to it. The sacral canal is a triangular canal, which means that it takes the same orientation as the shape of the sacrum. Remember, we tried to describe the configuration of the sacrum being a flat triangular bone. So the canal that is created within it also takes the same orientation, just as the shape of the sacrum. So the sacral canal is seen to be located behind the body of the sacrum. This is where we have the body of the sacrum here, harrowed in blue. And just behind it, at the posterior part, is where we have the sacral canal. This is what is seen to be harrowed here in red. So you have the space that is triangular in configuration, located behind the body of the sacrum. And driving through the alignment, let's see the structures that are seen to form the border of this canal. That means in the anterior part, because this is the posterior view, and we have the anterior view in the front. So anteriorly, it is bounded by the posterior surface of the body of the sacrum, but this is understandable. And you also see it being related to the posterior longitudinal ligament. And this is what is seen to be highlighted here in green. Remember, we described this posterior longitudinal ligament in our previous slide, running along the posterior border of the body of the sacrum. And we say that this ligament is seen to reinforce the joint along the vertebral column posteriorly. So you see it running behind. So it's also related anteriorly to the sacral canal, because the body of the sacrum is related to it anteriorly. So also the ligament that is seen to run along that course. So if you look at it from the body of the sacrum, we have a margins that is referred to as the pedicles. This is the pedicle here on one side, and we also have another emergence on the other side. This is a thick, short emergence, mass of bone that is seen to extend from the body of the sacrum and of course running posteriorly. And if you look at this emergence, at the superior surface or the upper border, we have the articular facet. This is the articular facet here, harrowed in green. We have two. We have one on this side, and we have another one on the other side. This is the superior articular facet that receives or connects to the inferior articular facet of the fifth lumbar vertebra. And this is seen to emerge at the upper part or at the superior border of the pedicles. We also have the laminae. The laminae are thin plates of bone that are seen as posterior extensions from the pedicles. Remember, we said the pedicles are thick mass of bone that are seen to extend from the body of the sacrum. This is what is harrowed here in black. And further extension posteriorly from these pedicles is where we have the laminae. So we have two laminae. We have one lamina here harrowed at this point, and we have another one on the other side. These two laminae, which are thin plates of bone, are seen to then unite posteriorly to form the spinous tubercle. So this is the spinous tubercle here, arrowed here along the midline plane. Remember when we tried to describe the median sacral crest, this is what is seen to be highlighted here in dotted blue. We say that this median sacral crest is formed as a result of the union of the two laminae of the individual sacral vertebrae. And this is what is seen here at this point. So this union of the two laminae will occur from S1 down to S4. So when it gets to the region of S5, you see that there is a non-union of this laminae. And this is what leads to the structural opening or defect that is referred to as a sacral hiatus. We'll also be dwelling more on this with this slide. Let's try and use this configuration down here to illustrate more of this formation. This region is where we have the sacral canal, and at the anterior part, we say we have the body of the sacrum. It means that the body of the sacrum is seen to bound the sacral canal anteriorly. So we have extensions from the body of the sacrum, and this is what is referred to as pedicles. We have one on this side and we have another one on the other side. This is what is seen to be highlighted here in red. Further extensions from the pedicle, we have the laminae. So this is the laminae here that is highlighted here in green. We say it is a thin plate of bone. So we also have another one on the other side. And at this midline region, you see them uniting to form the spinous tubercle. This spinous tubercle will then go down from S1 to S4. So this structure that is seen here is for the first sacral vertebra. So the second sacral vertebra will also be seen to present this kind of configuration where the two laminae will unite at the midline region to form the spinous tubercle. And it also goes down to the third and also the fourth. So this is how this build-up will continue. And from the first to the fourth sacral vertebrae, we have this orientation created along the midline plane. So this sacral tubercle is what we then characterize or define the median sacral crest. And this is what creates this alignment here at this point. So if you go to the fifth sacral vertebra, this is the fifth sacral vertebra. You have the lamina here at one side, and you have the second lamina at the other side. At this point, there's going to be the non-union of this laminae. And this is what will lead to this effect or opening that is referred to as the sacral hiatus. And this is what you see here using this upper image. You have this opening created here as a defect. And this is what is saying to be harrowed also here at this point. So you see that the sacral hiatus is formed as a result of non-union of the two laminae of the fifth sacral vertebra. And it's good that we're able to illustrate this. So let's drive further on the sacral canal. Let's try and see the content of the sacral canal. Before we go to the content, remember we described that it has a connection with the sacral foramina created on the anterior surface and also on the posterior surface. So you have the sacral canal here highlighted at this point. So you see this space, a triangular space that is created along the sacral bone. So as it goes, you see that it goes down along the sacral bone. And you see it connecting to the sacral hiatus down here. It is also seen to communicate with the posterior sacral foramina. This is what is seen here in this region that is harrowed here in yellow. It is seen also to be connected with the posterior sacral foramina on the other side. This connection is also created with the anterior sacral foramina. And we've tried to explain or justify the reasons behind this connection. Because we say that the terminal portion of the spinal cord, there's going to be the emergence of nerve roots, which are referred to as cordia equina. This cordia equina will need to pass through the sacral canal, And it is from this sacral canal that the root legs will be able to exit the sacral foramina. So let's drive back to the content. The structures that are located within the sacral canal include the cauda equina. This cauda equina are bundles of nerves that are seen to originate from the terminal portion of the spinal cord. We know that the spinal cord is not seen to extend to the region of the sacrum. It is seen to terminate around the lumbar vertebral level, and we have emergence of spinal nerves from that region. And this collection of nerve bundles will descend down along the sacral canal. And this collection of nerve bundles are referred to as cauda equina. The second structure that will be located is the filum terminale. This filum terminale is like a fibrous tissue that is seen to connect the spinal cord and attach it to the wall or the periostome of the coccyx. We know that the coccyx is located at the inferior part. So in trying to create a connection or holding the spinal cord along the vertebral canal, helping to hold it in place. And this structure is also contained within the sacral canal. We also have the spinal meninges, which include the dura mater and also the arachnoid mater. So these two structures are seen to extend also into the sacral canal. But these two structures are seen to be limited to the second sacral level. So these are the structures that are seen to be contained within the sacral canal. So now let's go to the lateral surface. We've tried to describe the anterior surface, the posterior surface. So this is the lateral surface. This lateral surface are two in number. So we have one on the side and we have the other one on the other side. This surface is seen to be wider above and it gets narrow below. It's seen with the articular surface. This articular surface is created for the connection of the ilium of the hip bone. And this is where the sacroiliac joint is formed. So if you try to use this image up here, this is where we have the articular surface here at this point. And this point is created for the attachment of the hip bone. Remember that the sacrum is seen to be connected to the hip bone around the posterior part through the sacroiliac joint. So it is on its lateral surface that this connection will be done. And this is understandable. If you use this image down here, this is where we have the articular surface. And if you look at this surface, it is configured in L-shaped pattern. So it has a L-shaped configuration. And this is what fits into the ala of the ilium in creating the sacroiliac joint. If you go more inferior to this space, you have the inferior lateral sacral angle. And using this upper image, this is what is harrowed here in blue. This inferior lateral sacral angle is for the attachment of the sacropostygmal ligament. If you go more inferior to the sacrum here, we have the coccyx that is highlighted here in yellow. And this is the point where they try to connect with the sacrum at the sacropostygmal joint. There is also a corresponding named ligament that is seen to reinforce this joint on the lateral side. So you have the connection of the sacropostygmal ligament helping to reinforce the joint between the sacrum and also the coccyx. If you also go more inferiorly, you have the attachment site for the sacrospinous ligament. And this is what is highlighted here at this point. This sacrospinous ligament is seen to connect the spine of the ischium to the lateral surface of the sacrum and also the coccyx. And this is what is highlighted here at this point. You also have the sacrotuberous ligament. This sacrotuberous ligament also emerges from the tuberosity of the ischium. And you see it directed or being attached to the lateral wall or surface of the sacrum and also the coccyx. This is what is also seen to be highlighted here at this point. So you see these two ligaments also taking their insertion point on the lateral surface of the sacrum and also the coccyx. You also have the coccygeus muscle, also connected to the lateral wall or lateral border of the sacrum. Question time. Let's go through this question to check our understanding of this lecture. And the first one is to describe the structure or the morphology of the sacrum and also highlighting its foramina. The second question is to highlight the structures that are related to the anterior surface of the sacrum. This we have adequately highlighted during the course of this lecture. The third question is to describe the boundaries of the sacral canal and the contents of the sacral canal. We've also tried to do justice to this during the course of this lecture. So thanks for watching this video. Let's continue to stay glued to this channel.